Morning Joe chief medical correspondent Dr. Dave Campbell and infectious disease physician and medical director of the Special Pathogens Unit at the Boston University School of Medicine, Dr. Nahid Bhadillia. She's an NBC News and MSNBC medical contributor. My thanks to having both of you on. Dr. Dave, where do we stand overall with this and where it's heading? Because once again, you hear a lot from the president that it will go away.
It's not going away. We're at 200,000 deaths. Worldwide, there's 1 million deaths. And if we use Doris Kearns Goodwin's words and use history for hope and perspective, we have to look back to the 1918 flu pandemic and realize there were 50 times more deaths worldwide. And now we're sitting at 1 million worldwide, 200,000 deaths in the United States. We're going to double that by the end of the year, Mika. And there's no end in sight. We've heard from Dr. Redfield that we cannot expect widespread vaccine availability until the summer or fall of next year, despite other statements that have been made. So it is important to remember that the concerns that we must all have right now today, with schools starting back up, with winter coming, with cold weather, must make us redouble our efforts to stop the spread of the virus using simple public health measures: face masks, hand washing, social distancing, particularly indoors, and I would say particularly in your own home, Mika.
Dr. Bhadillia, a good number of people are using masks despite the lack of leadership on this issue. Do you expect this situation to get worse before it gets better? Where do you think we stand from your point of view in terms of the virus?
Thanks so much, Mika. And, just to stress the 200,000 that we're seeing, those are deaths. I think when we look back on this retrospect, a lens that we're sort of getting a fuller picture, we'll look at the people who carried the burden of hospitalizations, the people who carried the burden of having long COVID, the debilitating symptoms that we're seeing in at least 10% of these patients who have COVID-19. We're going to see the people who are affected by the damage to our economic system for how long this was prolonged because we couldn't get it under control. And the biggest part of this, I think, a success for any outbreak response, there are a couple of components to that. One is the response itself. We need to have the supplies, the testing, and of course, we're lagging on those things. And I do hope that we do better on that. The other, as you mentioned, is the behavior change. It's the use of masks. It's reducing the number of people indoors. That's the thing that I think we're still feeling it. People are using masks, but there's definitely pockets of deep resistance to behavior change. And I think the reason it's been this way is because we have a group of our politicians, elected officials, who have never placed emphasis on that, who've always undermined the behavior change component. And that's unfortunately what I see continuing. If we cannot get vaccine-induced herd immunity, as Dr. Dave said, because we won't get vaccines to everybody by next summer, that means that we won't achieve that level where we can stop wearing masks for at least another year. And that's why the behavior change component is going to be important.
Tom, I'll let you take it to the doctors, but first, sort of political question for you. You had Jared Kushner of the White House saying that we'll be rocking and rolling by July on this virus. We'll be a lot better. Here's President Trump back on March 29th talking about what the goals are for success in beating this pandemic. Take a listen.
So you're talking about 2.2 million deaths, 2.2 million people from this. And so if we could hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
Tom, a lot of people think that a lot of these deaths are on the president because he didn't do some basic things that were backed up by science that would have prevented death.
The numbers confirm that. There were plenty of populous countries in the world that have relatively decentralized government like ours, federal systems, the European Union, which is more numerous than the United States, we simply didn't have a national response to it. Instead, we had a president who was mostly concerned about how this was going to play for him. In that clip, it's amazing to remember that he began this there's just a handful of cases, and has now moved the goalposts all the way to, well, I saved 2 million people, so be grateful that only 200,000 died. And we're going to have a lot more than 200,000 before this is over. I mean, it is really a startling reminder that the president of the United States doesn't care about the American people. And he put the response for this in the hands of his completely incompetent son-in-law in a case of nepotism producing actual harm to the American people, which is the other thing we sort of forget. Imagine that if we weren't living in this alternate reality, this bubble that the president has created around his own supporters. Imagine the outrage if any other president had put his or her son-in-law in charge of a national crisis and 200,000 people ended up being dead. And yet the president, because he is a brazen, he just comes out and brazenly says these things. He gets people used to the idea that, 200,000 people, what are you going to do? Nobody could have done any better. My son-in-law handled it. I really hope that we are somehow beyond being numb to that, because it is the most appalling dereliction of duty in presidential history.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.